Hello, everyone. My name is Saad Usmani. I'm the Chief of the Myeloma Service at the Memorial Sloan Kettering Cancer Center. And on behalf of the KarMMa2 investigators, I'm presenting a summary of this abstract oral presentation that was delivered at the ASH 2022 annual meeting recently. The presentation was specifically in cohort A, looking at the efficacy and safety of Idecabtagene Vicleucel in clinical high-risk multiple myeloma patients with early relapse after frontline autologous stem cell transplantation. And why is this particular cohort important? Because we do appreciate that patients who have that early relapse after frontline therapy, including autologous stem cell transplant, have a poor outcome. So there is data that, for patients who have early relapse within 12 months of transplant, from CID-MTR and other data sets, their overall survival is about 26 months compared to those who have later relapses with an overall survival of 91 months. And we already have, ide-cel approved both in the US and Europe for late relapse patients who've had exposure to the three classes of drugs, PIs, IMiDs, and anti-CD38 monoclonal antibodies. So KarMMa2 was a multi-cohort phase 2. The cohort that I'm going to be presenting on is the patients with early relapse within 18 months of frontline treatment, including induction, transplant, and lenalidomide maintenance. And this is the first presentation of this, data cohort. So for this particular cohort of the study, we had 37 patients enrolled with early relapse within 18 months of initial therapy, including transplantation. The primary endpoint was complete response rate. Secondary endpoints included overall response, progression-free survival, duration of response, time to progression, overall survival, safety, PK, health-related quality of life measures, and exploratory endpoints included MRD negativity rates, as well as biomarkers of response, such as serum levels of soluble BCMA. So if you look at the patient characteristics of those 37 patients, about a third of them, 32.4%, had high-risk karyotypic abnormality, including deletion 17p, translocation 414, and translocation 1416. And then patients, 5 out of the 37 had ultra-high-risk cytogenetics, so having 2 or more karyotypic abnormality. And if we look at the refractory status at the time of enrollment, it was 32 out of 37 patients. And from the patients, prior response, only 24% of the patients actually had a CR or better to their first-line treatment. So, lower than what would be expected for the overall patient population otherwise. Best overall response seen on this study was 83.8% overall response, CR or better seen in 46% of the patients, and the median time to response was a month. So, many patients actually exceeded their responses, even compared to their first-line treatment. Progression-free survival for the whole population, the median was 11.4 months at a median follow-up duration of 25.2 months. And of note, the median OS has not been reached with this follow-up period, and the OS event-free rate at 2 years is 84.7%. If we look at MRD negativity, those data were available in 34 of the 37 patients. 11 of 13 patients who had achieved CR or better were MRD negative at 6 months. 4 out of 5 who had achieved VGPR were MRD negative at 6 months. And if we start looking at MRD negativity in CR patients who are getting to the 12-month mark, 7 out of 10 patients had MRD negativity at that time point in the study. Adverse events, were similar to what have been reported for this particular, CAR product. CRS was seen in majority of patients, 31 out of the 37. But in terms of grading, only one grade 3 event was seen. Infections were seen in about 60% of the patients, but grade 3 or 4 seen in 8 of the 37 patients. Of note, 2 patients passed away due to adverse events, one due to pneumonia, 67 days post ide-cel, and one due to pseudomonal sepsis around 91 days post ide-cel. Looking at, the neurotoxicity, that was seen in 21% of the patients, so 8 out of 37. In terms of, time to median onset was about 3 days. None of the patients had a grade 3 or 4, so these were all grade 1 and 2 events. Duration of the event was about 3.5 days. And patients, 3 out of the 8 required glucocorticoid usage here. So, in summary, in this particular clinical high-risk patient population of patients who experienced early relapse within 18 months of initial therapy, including transplant, we saw high response rates, deep response rates, even compared to the first line treatment responses. Median duration of response was 15.7 months, median PFS was 11.4 months, and the OS rate at 2 years is 84.7%, which again is higher than what would be expected for this patient population. And these results do support a favorable clinical benefit risk profile for ide-cel and its potential use in this earlier line of treatment. Thank you so much.